Good afternoon, everyone. Thank you for joining PHCA for today's webinar, POLST in Long-Term Care, Respecting Treatment Preferences at the End of Life. I'm Wendy Johnson, Executive Assistant for the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and gain better understanding of practical application tools to equip our members so that you may continue to provide the highest level of quality care. Before I begin, I have a few housekeeping issues to go over. This webinar is being recorded and will be made available on the PHCA website by no later than tomorrow. The webinar has been approved for 1 continuing education credit for nursing home, assisted living, and personal care administrators. Certificates will be emailed by no later than tomorrow, along with a link to a survey. Please complete this survey, and if you are participating in a group setting, have each participant also complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions by using your questions pane on the right-hand side, and our presenter will address those questions at the end. Now for today's webinar. Today's webinar, the goal of today's webinar is to support long-term care facilities with tools and information to effectively implement the POLST program. So POLST helps to ensure the end-of-life treatment preferences of seriously ill or frail residents. Those for whom healthcare professionals wouldn't be surprised if they died within a year are documented and honored within facilities and across the care setting. The learning objectives for today's webinar are: provide an understanding of the POLST programs specific to long-term care, outline specific elements of implementation, describe a strategy to assure support of emergency medical services and compliance with residents' care preferences across care settings, and discuss options for individuals in assisted living and personal care. This webinar is being presented today by Marian Kemp, Pennsylvania POLST Coordinator from the Coalition for Quality at End of Life, and also joining in today's webinar, sitting in our PHCA's own Dawn Murr-Davidson and Gail Weidman. Marian, the floor is yours.
Thank you very much, and I really appreciate the opportunity to speak to your members about POLST. So, what is the purpose of POLST? Well, the POLST process was designed as a mechanism to define patient preferences for end-of-life care and to communicate those preferences across care settings. So I wanted to make you aware of where POLST is being used across the country today. Actually, it is pretty widespread, and in fact, only the states of South Dakota and Arkansas do not have POLST practiced at some level. Here in Pennsylvania, we've been using POLST since early 2000s in Western Pennsylvania. It has spread incrementally across the state. I know that there is a pretty wide level of use in central Pennsylvania, going east into Reading counties, Chester County, Lycoming County, up in northeast Pennsylvania. So it's pretty widespread in Pennsylvania as well. While it's hard to really track exactly where POLST is being used, we estimate about 75% of the counties in Pennsylvania do have some use. And those of you who have implemented POLST, we really appreciate your interest in the POLST process. So specifically, what is POLST? Well, I really want to point out that POLST is always voluntary. Importantly, POLST translates a patient goals for care at the end of life into medical orders. and these medical orders follow the patient across care settings. It can be from the hospital to the nursing home to assisted living into the community. The POLST can follow the patient when they're leaving a facility, perhaps for a patient visit or a one-day procedure. It can follow patients into the hospice setting. The POLST, importantly, consists of medical orders that are based on a patient's medical condition and his or her treatment choices. Now, these choices are established in a communication between the patient or his or her legal decision maker and a healthcare professional. A POLST conversation must always occur before a POLST form is presented. So consequently, once that POLST form is completed, it allows healthcare providers to know a patient's wishes in the event of a serious illness, and then to honor those wishes. So if you had a POLST form in your hand right now, what would really you would really notice is that it is a very bright color. Here in the state of Pennsylvania, we call our form Pulsar Pink, and we ask that it be copied on 65 weight stock. And the reason for that, we want a bright form so it can be easily found if there is an event and the orders need to be evaluated and reviewed quickly. We ask that you copy it on that heavier stock so that it can withstand a lot of use, a lot of hands touching it. We would like it to be fairly durable. And really importantly, I think among some individuals and perhaps in some facilities, there is a misperception about when POLST can be used, and is it just to limit care? That is not so. That is a misperception if it's an individual who thinks it is designed to limit care. While the POLST may be used to limit medical interventions for some patients at their request, it can also clarify a request for all medically indicated treatments, including resuscitation. The POLST is not designed to replace an advanced healthcare directive document or any other medical orders, such as a do not hospitalize order or the Pennsylvania out-of-hospital DNR order. Advanced directives are important, and the POLST process works best when a healthcare power of attorney has been completed and an individual has defined in this document who will be their agent, or you may hear this term surrogate or healthcare power of attorney. But as I said, the POLST process works best when somebody has been designated by a person to speak for them when they become unable to speak for themselves. And in this process, when this agent or surrogate is identified, the next step should be for a discussion to occur between the person completing the healthcare power of attorney and the agent to assure that the person that would make the decisions would have an understanding of the person's preferences and their values. While a healthcare agent can only be appointed through a healthcare power of attorney, in the event this process does not occur, a representative can be designated, and that's based on Pennsylvania law. There's a hierarchy established for that purpose. So for whom is the POLST form intended? Well, not all residents in a nursing home may be appropriate for a POLST form. And most 65-year-olds are too healthy to have POLST orders. The POLST form is designed specifically for those patients who are seriously ill or frail. And what clinicians can do, if they're trying to determine whether a POLST form would be appropriate, for example, you could do this in your facility and think about a particular resident. Would I be surprised if this resident died within the next year? And if the answer is no, I would not be surprised, then it is appropriate to consider a POLST form for that individual. Another thing to keep in mind is that the POLST can be used for individuals of all ages, both for pediatric and for the adult population. So if you've implemented POLST within your facility, decisions need to be made about who will fill it up. Well, you wouldn't be surprised if physicians would be filling out POLST forms. Also, nurse practitioners and physician assistants. But often what's happening in the long-term care community is that RNs and social workers are completing the forms. There's an important consideration, however. If you're an administrator and you're trying to determine what staff in your facility could be having these conversations, you need to consider who has the skills, who has the knowledge, and who's credible enough to physicians, providers, and patients to effectively conduct these conversations. So we'll talk a little bit about the importance of training these individuals. And I've done a lot of training. I've met a lot of nurses and social workers, a lot of individuals that work in long-term care. And, you know, I know that some individuals are so committed to helping to determine what somebody's preferences are, you know, really with a long-term goal of helping to assure that those wishes are respected. Some people do really well. I also know that there are a number of people who's had this responsibility delegated to them and are extremely uncomfortable about doing it. And you need to keep in mind, in fairness to the resident, in fairness to the resident's family, that it's really important that that person who has the discussion has the ability to effectively manage that. Another thing that you should know, and this sometimes can make the process easier for you, verbal orders are acceptable with follow-up signature. And you can apply this just as you do any other verbal orders. You know, you can follow your facility policy. You want to make sure that this is included in your policy. So, of course, there's no way I know how many of you out there have ever seen a POLST form. So I think we're just going to take a couple seconds here for you to take a look at the POLST form. And you can see that we have sections A, B, C, D, and E there. So take a look before I speak a little bit about the contents of the form. Okay. Well, the first section, cardiopulmonary resuscitation. And this is the section where it's designated if somebody wants CPR or not. Good to know, really important to know, is if somebody has a POLST form and you walk into their room and you find them, and you need to make a quick determination, is this somebody that wanted CPR or DNR? What you have to evaluate quickly, does this person have a pulse and are they breathing? If in fact they have a pulse and they're breathing, one or the other, Section A does not apply. Section A only applies when someone has no pulse and is not breathing. If they have a pulse and if they're breathing, then you need to refer to Section B to see what level of medical interventions has been their choice. So you can see that we have choices for comfort measures, limited additional interventions, and for full treatment. You probably, know that some individuals will choose aggressive treatment. They're not quite willing to give up. They don't mind going back to the hospital. They may not even have a problem with going to intensive care. A lot of times patients who you'll see in your course of work will have had multiple hospital admissions, and they may not be as willing to go back to the hospital, or may not be as willing to again be readmitted to an intensive care unit. They don't want to be intubated. So it's perfectly fine if that's their choice. If they want full treatment, you can check that. But, confirm if their interest is more in limited additional interventions. They may be certainly willing to go to a hospital if it's indicated. Somebody that chooses limited interventions generally does not want intensive care. And then the other choice is comfort measures only. And this is where someone is offered medication or anything that they need to help relieve their pain and suffering. It is important, though, if you're talking to somebody about these different choices, just make sure you never promise comfort measures will relieve your pain. Every effort will be made to do whatever needs to be done to provide greater comfort. It really is pretty much impossible to assure that somebody will be pain-free. We have a section there on antibiotics. One of the things that when people are talking about the POLST is that this seems to be difficult. And people sometimes have a difficulty making a decision because they know, they've had a cough and they've had antibiotics and they're feeling a lot better, or they've had a urinary tract infection and they've had an antibiotic, and that has relieved the comfort. So this can be somewhat difficult. And actually, if we ever get around to revising the form in Pennsylvania, it's very likely that this section, Section C, will not be included. But I think what happens most of the time when this section is being completed, that the middle choice is preferred, determine use or limitation of antibiotics when infection occurs. You'll see Section D, and this is where you'll talk about artificial hydration, and we're going to talk a little bit about that in a minute. You can see down there that there's a place where you could state patient's goals and medical condition and who the discussion occurred with, and there's a place for signatures. Now, in your facility, if forms are being completed, you want to make sure that each of these bullet points are followed to make sure that the form is valid. You want to have the patient name up there in the right-hand corner, and it's really helpful. You should include the date of birth. You need to complete Section A, that section that has resuscitation orders. You want to make sure that there's a physician, a PA, or a nurse practitioner signature. If you are a social worker or nurse that maybe completed the form, you're not going to sign it at the bottom in Section E. You're going to sign it on the back of the form. That form needs to be signed by the physician, PA, or nurse practitioner. And in Pennsylvania, the physician assistant signature needs to be co-signed within 10 days. And then we need a patient or surrogate signature. If any of these elements are not found, you do not have a valid POLST form, and you need to take steps to assure that it is completed. So I've talked about the validity of the form and that you have to complete Section A, but I'm also recommending that you complete Section B2. This is considered to be the heart of the form, and it's particularly important, I think, in long-term care. this is where you can designate, or you can find out how the patient wants to be treated now. This patient's in your facility, as we said. Do they want to be treated there as much as possible? Do they want to go to the hospital, etc.? So Section B provides necessary direction about treatment preferences that's useful for emergency personnel and other professionals in situations other than full cardiac and respiratory arrest. Excuse me. And there you can take a good look at the components of Section B. So what are some of the things that you need to do in long-term care? Well, you want to offer the POLST soon after admission for new admissions. It is not an admission form. It is not a form that's completed by the admission clerk. At the time of admission, there's too much going on for good consideration to be given to what, for example, for a patient to think about what my choice would be. But you do want to have this discussion as soon as possible following admission. For current patients, take a look at the form. It's recommended. I think this is what's happening fairly often in practice, that the form is reviewed quarterly at a care conference. If you're having the conversation, who should be there? Well, the resident should be there if the resident is capable of being there. And the legal medical decision maker should be there. You may ask the resident, who else would you like to be here? There may be one person in the family who is designated as the decision maker, but it's really helpful for other family members to understand what's been decided and what treatment would be occurring in the future in the event of a change in illness. You want to take a look at any prior advance directives. One of the reasons you want to do that is you need to know if there are any limitations on the decision making that have been designated for the agent. And you want to look to see if there's been attention given previously to thoughts on artificial nutrition and hydration. You certainly want to keep the form where it can be easily accessed. A lot of times, staff may be fluid. There may be somebody filling in, but you want to make sure that within your facility, who's ever working there needs to know exactly in each situation where they can find the form, and it should be easily found. Really important is the fact that the POLST form always needs to go with the patient. Now it says here, send original POLST with patients. You're not going to be penalized if you make a copy and send it. And sometimes facilities are reluctant to send the original because they're not going to get it back. If you are copying the POLST form, it's helpful if you copy that on pink stock as well. And then you want to review, I've talked about reviewing at the quarterly conference, but you also want to review and potentially update the form if the condition of the resident changes. So we haven't spoken a lot about advanced directives, but sometimes it's helpful to clarify the differences between advanced directives and POLST. And this table here can also be a good training tool if you're trying to provide information to your staff about what is the POLST. They may be familiar with advanced directives, but if you haven't been using POLST, they may not know the difference between that and an advanced directive. So an advanced directive is recommended for all adults. Everyone over the age of 18 should have an advance directive. And I'm strongly recommending to all of you who are listening in today that you complete an advance directive. You may not particularly want to complete the living will. You may not want to go through it and say, well, I want tube feedings or this or that. But it's highly recommended that you choose and designate on an advance directive who will be your decision maker. The POLST is only, as we spoke about, for those who are seriously ill or frail. Importantly, the POLST form is completed based on a patient's current care and current condition. And that's why if a condition changes, you need to review the form and potentially change it. The advance directive is completed by patients or individuals, and it's the responsibility of a healthcare professional to engage the resident or decision maker in that conversation. The living will portion of the advance directive only becomes effective if somebody is incompetent and permanently unconscious or has an end-stage medical condition. But the POLST is effective as soon as it's signed and dated, signed by the doctor or nurse practitioner and or the patient and medical decision maker, and dated. So it can become effective immediately when all the requirements are met. Just a couple more comments here. A surrogate cannot complete somebody's advance directive, but they can be engaged in the conversation to complete a POLST form. And the healthcare professional always has the responsibility to assure that it goes with the patient and that they initiate the periodic review. All right, before we talk a little bit about implementing POLST, that was pretty much the basics, really POLST 101, really an overview. We could really talk about the details about POLST for quite a period of time, particularly the POLST conversation. And you know, at the end of this session, I will give you information on how to get further information. But you know, certainly we have a lot of information available, and you know, if you have questions or concerns, please reach out. We've a lot of POLST champions in Pennsylvania, and you know, I'm a primary resource for information. So we're going to talk about implementing POLST right now. So this part of the program is to serve as a guide in that implementation. However, if you've already implemented POLST, hopefully this information will be useful in reviewing your implementation status, and it also may provide recommendations for areas in which improvement can occur in your facilities. One of the things I've learned over time, and I think probably the majority of people who have implemented POLST, is that it always takes longer than one would expect. And it cannot be satisfactorily accomplished without a lot of support. So in your facilities or in your system, you want to gain the support of your medical and nursing administration, and certainly director of nursing, social service, etc. It's one of the most important keys to a successful implementation. You also want to include some others. It can be helpful to include get legal advice. If you have online medical records, talk to IT, and pastoral care. Having pastoral care involved and chaplains, etc., having an understanding of POLST can be very helpful. In some facilities, there are actually well-trained chaplains that may engage in at least some of the conversation as well. You'll find that it's difficult to do it alone. You know, you need to gain support within your system, but also utilizing outside expertise can move your program along. And, you know, perhaps what you might want to do is if you're implementing POLST and you know that ABC nursing home across the county has already implemented POLST, it can be helpful to reach out. You know, if you do that, you know, you may get a better understanding of, you know, some of the requirements, and, you know, you could potentially avoid some of the barriers too. You want to have your policies in place. You're not going to get anywhere unless you have ongoing education of your staff and involvement and support from EMS and emergency medicine. Imagine, you know, if you have had a conversation in your facility with someone, this individual and their family, you know, really thoughtfully considered what their choices would be. They're satisfied with the choices. But then they're being transferred to the hospital across town. And that hospital doesn't know what the POLST is. That's a disservice to the patients, your residents. So you want to reach out to those systems that send you patients and also those systems that receive your patients, so that especially the emergency department has an understanding. And you also want to gain support of EMS, and we'll talk a little bit more about EMS in a couple minutes. So here's a couple pointers too. You want to do a needs assessment. For example, what are the issues associated with care? You know, if you're, if you are going to be providing comfort care, is palliative care offered? So you take into consideration how you can meet the needs of your residents and needs of your staff. You want to develop your program components, and you know, that's, I said, your policies, your training, that type of thing. We talked about coordinating your plan with other facilities in your area, and then you want to monitor your program. We've had this checklist out there for facilities to use, and you can take a look at the steps there, developing your policies. And you can look there, you want an advanced directive POLST, process for review, procedure to address conflicts, but there, policy to accept POLST forms from transferring facilities and providers, because if you're accepting these forms from other facilities, it's very likely to have been signed by a healthcare professional that's not on your staff, so you want to be ready for that. You want to have your education plan in place, as I said. You're going to notify your key contacts. Who you're going to start with, just your new patients, or you're going to start on you know, one floor, or you're going to really be aggressive and you know, try and get through your whole facility in X period of time. And there can be a number of elements associated with quality improvement that you want to have a plan in place to track compliance. Is the form being completed appropriately? You know, there's elements that we talked about to make the form valid. Is that occurring? Are you getting the doctor's signature within the appropriate period of time? Taking a look at your form to make sure there's not any inconsistencies. For example, somebody chosen CPR. They want to be resuscitated, but in Section B, the request is for comfort care. Well, that's inconsistent. Somebody wants if somebody wants resuscitation to be attempted, they need to be willing to accept intubation and hospitalization if, in fact, the resuscitation is successful. So here's a couple points here from our recommendations for policies. I'm going to say it before that say it again, excuse me, that the completion of POLST is voluntary. It cannot be standard to offer POLST to all patients. However, let me just take a look at we do know that in nursing homes in Pennsylvania that many facilities are offering the POLST form to those individuals that you wouldn't be surprised if they died in the year. And generally, I'm talking about rehab patients or, people who come in for other reasons, but with the full expectation that they're going to be going home and they're going to be going back to the community. We know facilities are doing that, and we're not going to give you any demerits for doing that either. And the reason that is occurring is that facilities don't want to have two different forms where CPR status is designated. So they've elected to go with the POLST form. But again, the POLST form is voluntary, and you can't demand that a resident sign a POLST form. You have to remember that the POLST form is a set of medical orders and to be followed by as any other medical order. And you can consider putting, or you should consider putting in your policy who the POLST will be offered to. You want to put in your policy who's going to be engaging patients or their surrogates in the conversation. And then number 5 says, if the resident patient is unable to be engaged, a plan exists to assure that the conversation occurs with the appropriate decision maker. So it's essential that you make sure that you're speaking to the right person. If somebody there, if you believe that patient is a surrogate and they sign the form, turns out they're not, you can have some problems there. Always establish that you're having a discussion with the appropriate individuals. Okay. All right, now a couple points about POLST and EMS. So you can look here and see at the top of the form it states, to follow these orders, an EMS provider must have an order from his or her medical command physician. This is really unique to Pennsylvania, a unique requirement. And the reason that it says that on the form is that here in Pennsylvania, we have an out-of-hospital DNR order that applies to EMS, that applies to first responders. So in Pennsylvania, by law, currently, EMS providers may only follow a Pennsylvania out-of-hospital DNR order, bracelet, or necklace. So, in the event that, say, a patient is being transported for EMS to follow those orders, EMS will need to contact their medical command. That may seem like an extra step, and it is currently, but always keep this in mind. I guess one of the other things I'll say though about the out-of-hospital DNR order, the out-of-hospital DNR order, that if you are somebody that has responsibility for individuals in the community or for individuals in assisted living, you may want to consider the out-of-hospital DNR order for those individuals, because this can help assure that in that particular environment, that person's choices will be followed. Now, that's not to say that the orders on a POLST form will not be followed, because, as I said, EMS can contact their base command physician for information. So when they contact their medical command, When EMS has a POLST order in their hand, that form should simplify any discussion relating to termination of resuscitation efforts. That conversation can be helped when that POLST form is in hand. So customarily, when a medical command physician is informed of the POLST, instruction will be given to honor the POLST. Now, oftentimes, if you're in a nursing home and you're transferring a patient and it's, not an urgent situation, you're calling for EMS, if you advise them at the time of the call that the patient has a POLST form, these are what the orders say, EMS often has the opportunity to clarify what they need to do even before they arrive on the scene. So it can be really helpful when and if a decision needs to be made en route. Well, what I wanted to tell you here is that currently in the state of Pennsylvania, there is no law, there are no regulations that guide the use of POLST. POLST is being used as a standard of care. We are hoping that there will be legislation in the state of Pennsylvania relatively soon. POLST legislation has been introduced both in the House and in the Senate. We are hopeful, there's no expectation that there'll be a vote on it here this summer. There's been issues with the budget and many legislators are taking vacation. I don't know, if the legislator is going to be out of session for any period of time, but we are hoping that there'll be a vote on this legislation by the time we get through the fall. If you're using POLST now, you don't need to be worried that you're going to have to make a lot of changes. I think that the legislation will simplify many things for you. And we talked about accepting forms that are signed by a physician not on staff. The legislation will require that you do recognize the POLST forms and accept the medical orders on the form if the physician is not on your staff. I talked about POLST being used in a lot of places. There are, especially some hospital systems that are reluctant to use POLST because currently there's no liability protection for providers acting in good faith. The legislation will provide that. Reciprocity with other states will be allowed and actually encouraged. This is important too. If anybody's listening and they're, on one of the borders, you may be seeing POLST forms that come from Western New York or West Virginia. And now I think, there are more forms that are coming from the state of Maryland. The fourth bullet there says signature requirements. What that means is there was discussion about who legally could sign the form. Would it need to be only a physician? And the legislation currently as written will clarify that the POLST form can be signed by a nurse practitioner or a physician assistant as well. And when this legislation is signed and out there, the out-of-hospital DNR order, those orders will no longer be written. If somebody is out there and they have one of these orders, it will still be valid, but the POLST form will replace that out-of-hospital DNR order. It will clarify the role of EMS in following POLST forms. They will be able to follow the POLST orders without that intermediary call to their base command. However, that doesn't mean that if they, have a concern, their medical command physician is always where they need to go if they have questions, any questions relating to following orders on the form. If you look at the POLST form, down in the lower left corner, you'll see that the POLST form that we're using here has a 2010 date. The reason for that is that the POLST form hasn't been updated since then because there hasn't been a process in place or an advisory committee in place. The legislation will establish that there will be an advisory group who will have the ability to review and update the form. And very importantly, there will be a home for the POLST program in the Department of Health. So all administration of the POLST program will be in the Department of Health. Just quickly here, we're getting close to the end, but I wanted to, as I said earlier, speak to you about where you can go for information. We have a POLST website. Many of you may have already been there. It has a really long email address, so I didn't even put it down for you, but the quickest way to access it is to Google POLST in Pennsylvania, and you can get there that way. When it comes up, this is the top of the screen, the first half of the screen, and you can see there that there's a link, Watch POLST in Action in Pennsylvania video. We have that video out there. It's about 11 minutes. It's another good tool that you may want to use when you're educating in your facility. It's also a good tool to use if you're trying to educate your residents and families. Another tool that's useful you can find here is a patient family brochure. There's not a whole lot of information strictly designed for the public, but the brochure is a pretty good tool. And sometimes what's done, if you know that you're going to have a meeting and you're going to be talking about the POLST, you can actually in advance give the individuals you'll be meeting with a copy of the POLST form and the POLST brochure and say, this is one of the things that we're going to be talking about in our scheduled appointment. I just want you to take a look at it now. I mean, you really want them to know that they're not going to check any of the boxes, but, a little bit of information in advance may be useful for them. If you need to get the POLST form, you can go here. There's also a Spanish version POLST form. I click to the next screen, which is showing some other links there, including different policy examples. I also want you to know that, and you can contact me if you're interested in POLST training. We have a course, it's called POLST Doing It Right, and it is specifically designed to help improve the POLST communication and the POLST conversation. It's an 8-hour credit course. It's 2.5 hours online and then 5.5 hours in person. And we actually partner with institutions and facilities across the state to present that program. All the material is made available, and it's gotten some pretty good evaluations. And then last here is some general resources if you want further information on POLST. You may be getting POLST forms from other states. You can go to www.polst.org, and you can click on any state to find out more about their programs. We encourage you to do that. And then this last slide shows my contact information. And I want to thank you very much for listening to me for this long period of time. And if you have any questions, I'd love to answer your questions.
Thank you, Marian. Appreciate the great information today, and I do have some comments and questions already coming in. So if anyone else has any questions at this time, please type those into the question pane on the right-hand side of your screen, and I'll go ahead and get started in reading these so that we can wrap up on time and give everyone a little bit more time in their day today. So the first one I have is a comment. So let me read this to you. It's good information. Lancaster General Hospital offers a free facilitator training to anyone who is interested. And if you have a large group to be trained, they will come to your facility. Meredith Mills shared this with us from Country Meadows, and she says it's phenomenal training. I'm going to give a plug here for the annual convention at Seven Springs, which is going to be held September 26th to the 28th, and we are trying to get some speakers from Lancaster General Hospital to come out and offer a session on POLST during that convention. So know that we are, continuing the conversation and the dialogue and the training. But if anyone's looking for something outside of that, and I would encourage, those people who weren't able to be on this call today. You may have others who may have signed up and, just weren't able to make it happen today. Just let them know that A, this session is being recorded, and B, that we will, again, continue the topic offering at the convention.
I appreciate hearing that information about your convention, and I also want to comment on Lancaster General's training. They're actually utilizing our training tools that I spoke of, and they've done the training a number of times. Actually, when we developed the training, they were the first facility to present it, and they've done a really good job. There's a lot of experts in that system, and they always do a great job.
Great. The next question, I have two more questions at the moment. If anyone has any questions, please feel free to type those in, and we'll get them, we'll have Marian answer them here. The next question that I have is, does Advanced Directive trump POLST, or is it the most recent signed document?
Well, what your question is telling me is that there is some inconsistency between the Advanced Directive and POLST. And, my first recommendation is that you try and clarify that inconsistency. And that may mean that one of the documents needs to be revised. But the other comment I can make on that is, and I hate to keep talking about legislation that we don't have in place now, but the upcoming expected and hoped for legislation will indicate that the document with the most recent date should be followed. But again, it's really important. Why is there that inconsistency?
Okay, are we ready for the second question?
I am.
I think so. Let's go with the next question. For patients who are already on a vent receiving full treatment that want to change their advanced directive for the next time they get very ill, can you complete a POLST for comfort care while receiving full treatment at the time of completing the form?
Well, first of all, it would be kind of difficult, in many situations, having a conversation with somebody on the vent. I think you have to take the situation into consideration. Is that person on a vent capable of engaging in that conversation? Now, they may not be, and, you can go then to their legal decision maker. It's kind of an awkward situation, and you know, what this speaks to is the importance of having these conversations earlier on, you know, and, you know, if somebody's had a hospitalization and, you know, they, get hospitalization that includes intubation and ICU or whatever, that is the time, you know, once the ability to have the discussion returns, that is the time to speak about choices or, you know, based on the current condition.
Okay, any other questions? We only had those 2 questions and the 1 comment. If there are any other questions, get those typed into your pane, and also in the follow-up email that I'll send out, I will include Marian's contact information. So if you do have any questions that you think about, you know, in the next couple days or weeks, you can get in touch with her easily by just going back to your email to get that contact information for Marian. I'm sure she would be happy to answer your questions. Okay, I'm not seeing any more questions. Don't forget, the survey will be emailed by tomorrow, and a recording of today's presentation will be made available on our website at phca.org. Please take time to complete this survey, and thank you again to Marian for presenting on this topic. Have a great day, everyone.
Thank you.